And another one is Ehrlichia, which is having a morula-like appearance. Okay, morula-like appearance, and that happens to be within the phagocytes. And Ehrlichia Ehrlichiaensis, Granulocytophilum, all those particular Ehrlichia. So that is there in the rickettsial family. Q fever, done by Coxsackie Burnett, another important question. That table which I have told up in the rickettsial family member is very important to remember. Laws, fleet, tick, tick, mite. Okay, so that also you can remember once, and definitely a question is there. So guys, these are those particular topics from which the question will definitely come. Okay. Another hot favorite is bacterial vaginosis. Bacterial vaginosis is like Gardnerella vaginalis. Okay. That is Amsel's criteria. Short question. Drug of choice, metronidazole. Trichomoniasis, drug of choice, metronidazole. Giardiasis, drug of choice, what? Metronidazole. So like that, you have to focus on falling leaf-like motility. Okay. Besides that, if somebody asks you regarding those particular winter bottom sign is seen in, so that is seen in sleeping sickness. Okay, that sandfly involved with kala azar. What is drug of choice? Kala azar, liposomal amphotericin B. Okay, so that particular thing also needs to focus upon. And Chagas disease, Trypanosoma cruzi. Then those coccidian parasites, if somebody asks, another very hot favorite question, the coccidian parasite stuff. Coccidian parasites, that is Cystoisospora is having the highest oocyst size of 36 micron. Then Cryptosporidium parvum is there, for which you use methoxygenide. Otherwise, you use cotrimmoxazole. In toxoplasma also, like you use the drug sulfadizine. So that is there, sulfadizine pyrimethamine. Okay. And congenital toxo, they can give you like what are the features? The hydrocephalus is observed, and calcifications are observed, and all that stuff. Okay. In the malaria, they can ask you regarding the Plasmodium falciparum. As I've already told you that the most important in them is banana-shaped gametocyte, by which their diagnosis is mostly made. That is banana-shaped gametocytes and all. Okay. So that mnemonic, you know, the umber. So the umber is like what? All age RBCs involved, Morris dot, banana-shaped gametocyte, ECOL forms. This particular recrudescence is observed in that. Renal failure is observed in the Plasmodium falciparum. Okay, and Plasmodium falciparum, what are the conditions which protects against it? That is the GST. That is G6PD deficiency, sickle cell anemia, okay, thalassaemic trait, and excess of fetal hemoglobin. And what about the Plasmodium vivax? That is the Duffy negative RBCs. They are protective against that. Okay, so these are the important ones, and which is the infective form for the humans, that is the sporozoite. For the mosquito, that is the gametocyte. Okay, so all those particular ones. Babesia microti is having that Maltese cross stuff. So you need to focus upon that also. Okay. Now, in the case of this helminths, you need to focus upon the cystosomes. Cystosomes is which is having a terminal spine. Okay. Terminal spine is observed in hematobium, associates with urinary bladder carcinoma, terminal hematuria. Okay. Which one associates with the like having a lateral spine? Lateral spine is observed in lateral spine is observed in Mansoni, and rudimentary spine is observed in Japanicum. Okay, so leads to those Katayama fever and all that stuff. What is the drug you use for them? Drug you use Praziquantel for cystosomiasis. Okay, and besides that, granuloma formation happens in them also. Cat scratch disease also associated with granuloma, so that also needs to focus upon there. Then in neurocystic sarcosis, the most common site subarachnoid, more than parenchymal. Drug of choice, albendazole. Okay, steroid should be given. That is there to bring down the edema, and which is the larval form of Taenia solium, known as Cysticercus cellulosa. What about the other one, Cysticercus bovis, for the Taenia saginata? Okay, how does infection happen? By eating up infected pork. Okay, having Cysticercus cellulosa, or by eating up the eggs. More, it is by the eggs. Fine. And regarding those metacercaria stuff, that is there in that particular trematodes. That is the infective form in most of them. But cercaria is the infective form for whom? Cystosomiasis. Okay, and in the case of nematodes, you need to observe up two important things. That eat was the mnemonic for them. Those whose infection happens by eating up the eggs. What is eat? E is Enterobius vermicularis. That is by eating of the eggs of it, the infection happens. A is Ascaris, and T is Trichuris trichiura. And Trichuris trichiura egg you have, this type of egg which is having a mucus plugs in both the sides. Enterobius vermicularis is having this plano-convex egg. Ascaris, that a typical well-shaped one. That is a typical Ascaris egg. So eat, that is egg. And what about the ANS? Ankylostoma duodenale, okay, Ankylostoma duodenale, Nicator americanus, and Strongyloids stercoralis. These are the ones which enters through the sole of the foot, and the flariform larvae is responsible for them. Flariform larvae is responsible for them. Okay, so this is also one of the things to be remembered, and they are the ones which goes to the lungs, including the ascaris. Okay, now another question which is being asked, which one associates with HIV positivity and all? Strongyloids stercoralis. Okay, what is the drug of choice for Strongyloids stercoralis? So that is the drug which is being used nowadays in the corona also. That is ivermectin. So in the corona, if somebody asks you which drug is said to be reducing the mortality, the answer is that is the steroids only. Steroids are the one which definitely have an action in reducing the mortality. So from that ivermectin, I got to remember that point also. Now, besides this, all these points regarding the parasitology stuff, the Ankylostoma duodenale, this one sucks the blood, leads to iron deficiency anemia. Okay, and that particular having a blastomeus, that is the typical egg of this hookworm and all. And in the hookworm, the question which is coming up is this Ankylostoma brasilensis. This Ankylostoma brasilensis, this one leads to what? This leads to cutaneous larvae migrants. This leads to what? Cutaneous larvae migrants. Okay, this particular one leads to what? Cutaneous larvae migrants. And the visceral larvae migrants, TV. That is, you remember like this TV. That is, T is Toxocara, not plasma. Toxocara canis and Toxocara catus. They leads to this visceral larvae migrants. Visceral larvae migrants. Okay, this also needs to observe. Then those non-bile stained eggs, you remember them by this mnemonic NEHA. Okay, non-bile stained eggs. We have already discussed up, so I will not be discussing them. Nicator, there's an Entropius, H. nana, and Ankylostoma duodenale. So they are non-bile stained. Other all are what? Bile stained. Fine. So this is also important one which you need to focus upon. Okay. Then some questions which can be asked regarding the scaris that leads to intussusception and all. It goes to the lungs, leads to this Loeffler syndrome stuff. Okay, and besides that, in the filariasis, you have the dancing worm sign, which can be asked. Which is the infective form? Infective form is flagelliform larvae, L3 stage, in the case of filariasis. And which particular drug is used? DEC. And for that provocation, also we use DEC provocative test, daytime testing, if we want to do. Otherwise, it comes in the night time only. And what you observe in the tail tip, there is no nuclei in the case of Wuchereria bancrofti microfilaria, whereas terminal 2 nuclei is a feature of what? Bruchia malai. Okay, so guys, if you focus upon these all points in your exam, onchocerca volvulus leads to onchosarcoma, or that is termed as subcutaneous nodules, and this particular one leads to river blindness, another favorite question. And this also is having this particular drug, that is the ivermectin as a drug of choice. So ivermectin having 3 roles now. This particular one, along with that in that Strongyloids stercoralis and in the corona also, you using this ivermectin. And this onchocerca volvulus, just now I told you, this leads to onchosarcoma and river blindness. And river blindness is a type of night blindness which happens in and around the river. Okay. Then guys, another fellow, that is lower lower, and this lower lower is there, which leads to loesis. Okay, this particular one leads to a eye disease that is termed as loesis and associates with a swelling, and that swelling name is what? Kala bar swellings, and they are the migratory swellings. Okay, they are the migratory swellings. Then you have this Trichinella spiralis, which is also termed as muscle worm. Trichinella spiralis, which is also termed as muscle worm, and important is this one is viviparous. It does not have any eggs and all. It is a viviparous stuff. Okay. So regarding, if somebody asks you regarding the motility stuff, you remember 3 points. That is TDS, tumbling, darting, swarming. Tumbling is seen in Listeria. Okay. Darting is observed in Vibrio cholerae, and swarming is seen in the Proteus. So these all are very important points which are coming in your exam. Okay, so that also based on temperature, psychrophile, mesophile, thermophile, that particular stuff, all those oxygen requirements. But you need to remember obligate aerobes. What are obligate aerobes, guys? This was a question of FMG. That is the pseudomonas, mycobacterium tuberculosis, even the brucella. Okay, even the brucella is also termed as sometimes obligate aerobe. Okay, so all those nocardia is an obligate aerobe. And as per the obligate anaerobe is concerned, so you know that Clostridium is an obligate anaerobe, along with actinomycetes. Okay, actinomycetes, guys, you know that particular one. They can give you a history, or they can give a picture of this cervicofacial region, and they can ask up which triad is observed: swelling, sulfur granules, sinus. Okay, when you put them out and you crush them, you see the sun ray appearance. And drug of choice is penicillin. Nocardia, they will give a paraffin bait technique is used for that, and they will give a history of some pulmonary infection and all. So you have to relate up with your all these senses, and if you focus upon this 1 hour, most of your case scenarios of meningitis, encephalitis, that is associated with enteroviruses, encephalitis and all. Okay, hand, foot, mouth disease, these particular one, rabies stuff, or any sort of viral infections and all, which I've told up in and around in the image based stuff also. These all are coming in exam. Okay, so this 1 hour video, if you just see up before the exam, your all questions are sorted for sure. Bacterial vaginosis, trichomoniasis, curded discharge, these candida stuff, cryptococcus stuff with the meningitis, what you do that, what is the drug of choice, amphotericin, flucidocin, cryptococcus meningitis. Okay, so or what are various zymophic fungus, these all are the questions which will coming in the microbiology. And this is a must know for FMG also, this is a must know for INCT also, this is a must know for NEET PG also. If you see up this 1 hour video, mostly questions of yours will be sorted up, okay, which I have discussed in a obviously rapid fire manner. And very best of luck, guys, and do pass up with the flying colors. And this is for all exams, I'm telling her, for the FMG also, from the INCT also, from the NEET PG also. Very best of luck. This is in life, all things are there in your mind. Okay, if you think you can do, you can do. If you think you can't, you can't. Okay, so basically believe in this ideal. मैं लगा रहा था उम्र, परिस्थितियां बदलने में गालिब. जिस दिन मनस्थिति बदली, उस दिन परिस्थितियां खुद ब खुद बदल गई. So it's all there in the state of mind. If you think you can do it, you will pass. If you think you can't, you will not. Okay, so basically इन्हीं चीज़ों पे फोकस करो, लाइक बी फोकस्ड. ठीक है, आराम से क्लियरली. अगर सिंगल लाइन का भी तुम्हें मतलब क्वेश्चन आ रहा है, उसको भी अच्छे से करो. और अगर कोई केस सिनेरियो आ रहा है तो डरो मत, बहुत लंबी चीज़ें मत देखो. उसका हैक है, उसके लास्ट तक पढ़ो एक बार, उसके मार्क करो इंपॉर्टेंट पॉइंट्स को. और जो तुम्हारे सिंगल पॉइंट चीज़ें हैं ना, फैक्ट्स जो तुम्हें याद हैं, उसकी हेल्प से भी तुम वो क्वेश्चन आराम से कर सकते हो. ये भी एक ब्यूटी है. अगर आपको कुछ फैक्ट याद है ना, तो आप उस केस सिनेरियो को बहुत अच्छे से कर सकते हो. अगर आपको मतलब एक सिंगल पॉइंट उसके बारे में पता है, और आपको 2-3 ऑप्शंस, आप मतलब 2 ऑप्शन पे अगर आप रूल आउट कर रहे हो ना, तो ईजिली यू कैन आंसर द राइट वन. और एक और चीज़ इंपॉर्टेंट है कि मतलब ज़्यादातर जो है ना, फर्स्ट जो ऑप्शन आती है ना तुम्हारे, वही आंसर होती है. तो इस पर ये फोकस करना कि जो तुम्हारे फर्स्ट क्लिक करे ना, वही ज़्यादातर आंसर होता है. ठीक है, सो ऑल दीज यू नीड टू फोकस अपॉन for the exam. Very best of luck, guys. Thank you so much.